This is basic approach to chest x-ray series, and in this video we'll learn the concept of silhouette sign, one of the chest x-ray signs very important for exams and also in day-to-day clinical practice. So first we'll see what all we'll learn in this video. What is silhouette sign? Its actual verbatim definition. How does it help in localizing intrathoracic lesions? How to correlate the silhouette sign clinically to achieve diagnosis on a chest x-ray. Lastly, we'll see some interesting cases where we apply the silhouette sign. What is a silhouette? Here I am showing a diagram of silhouette. It is nothing but outline of a solid object, and along its border if you put a similar intensity object, that border of the silhouette is obscured. This is the basis of silhouette sign. So on chest x-ray it is the same concept. An intrathoracic lesion touching the borders of heart, aorta or diaphragm will obscure that border on chest x-ray. That is the definition of silhouette sign. And an intrathoracic lesion not in anatomical continuity with one of these borders will not obscure the borders. In this x-ray you can see a lesion in right hilum which is obscuring a part of right heart border because it's in anatomical continuity with the border. So for this to be true, the lesion or the opacity obscuring the border must be of similar intensity or similar density as that of the obscuring border. If it is of different density, then it will not obscure the border. But this is not part of the definition of silhouette sign, but you must remember this. So these are the structures forming right heart border and left heart border. In detail about normal chest x-ray anatomy I have explained in the first video of this series. You can find it in the thoracic imaging playlist in my YouTube channel. Please see the video. Coming to the important part of the talk, how to localize the opacity using silhouette sign. So now if right paratracheal stripe is obscured like you can see in the x-ray, then the lesion is supposed to be in right upper lobe. Now if right heart border is obscured, then the lesion is in right middle lobe because it is in anatomical continuity with the heart, or it can be in medial basal segment of right lower lobe. These are the structures touching the heart. If the opacity is obscuring the right hemidiaphragm, what is the lobe in direct continuity with the hemidiaphragm? It is the right lower lobe. So the lesion or consolidation is in right lower lobe. Coming to the left side, if the border of aorta or aortic knuckle is obscured, lesion is in left upper lobe. If left heart border is obscured, then the lobe closest to it or in continuity with it is the lingula or lingular segments of left upper lobe. So the lesion is supposed to be there. If left hemidiaphragm is obscured by the lesion or opacity, then it is localized to be in left lower lobe. Once we have localized the opacity using silhouette sign, we will clinically correlate with the details of patient to obtain diagnosis. So first look at patient history, whether he has any cough, fever, loss of weight or appetite. If all three are present for more than 2 weeks or equal to 2 weeks, suspect tubercular etiology, either consolidation or granuloma. Only if cough and fever will suggest infective, more probably loss of weight, whether it's neoplastic mass. So this will help in management because the management differs for infective and neoplastic lesions. If the patient is asymptomatic but has some old history of infective or tuberculosis, then you find opacity of a lobe or a segment. Suspect this opacity to be a collapse. This will show other signs which we'll discuss in later videos. Next, pay attention to the clinical examination findings. So, abnormal breath sounds in any segment of the lung plus chest x-ray findings showing pathology in the same will help us localize the lesion or the opacity and will achieve diagnosis early. Let's discuss the cases. So, what do you see in this first case? We see opacity in left lower zone. So this is x-ray, so mention zone, and zone is not equivalent to lobe, as you all know. Let's localize it to a lobe using Silhouette sign. So left hemidiaphragm is clear, left heart border is obscured. So this lesion, as we discussed, the opacity is likely to be in lingula of left upper lobe. So left lower zone opacity is in left upper lobe. Now this is case 2. Here you can see homogeneous patchy opacity in right lower zone. So which border is obscured? Right heart border is obscured. So apply the Silhouette sign. Which lobe is in continuity with right heart border? Right middle lobe. So right hemidiaphragm is clear, heart border is obscured, opacity is in right middle lobe. And if you can see clearly here, you can see some linear lucencies. These are nothing but air bronchograms. So this is suggestive of consolidation. So this patch of airspace opacity is consolidation, not a mass. Like, share and subscribe to our videos on YouTube and Instagram. Follow us at Radiology Doodles. Thank you.